Welcome, everyone, to our latest installment of Three Plastic Surgeons and a Microphone. I'm Dr. Sam Jejurikar in Dallas, Texas, and I'm joined, as always, by my co-host, Dr. Sam Rhee from Paramus, New Jersey, Dr. Salvatore Pacella from La Jolla, California, we today are going to talk about current events and current news in plastic surgery. But before we get into the meat of our program, as always, we have to take care of our business, which is the always scintillating disclaimer. And so just remember, this show is not a substitute for professional medical advice, diagnosis, or treatment. The show is for informational purposes only. Treatment and results may vary based upon the circumstances, situation, and medical judgment. After appropriate discussion, always seek the advice of your surgeon or other qualified health provider with any questions you may have regarding medical care, and never disregard professional medical advice or delay seeking treatment because of something you may have heard in this show. And before we get into the meat, gentlemen, how are you guys doing today?
I'm doing pretty well. Good. Yeah. How's you guys?
Good. It's a little brisk morning here, a little cold, about 60 degrees.
Sal, I have nothing to say to you now.
It is actually warmer in Dallas than it is in La Jolla because it's warmer than 60 right now. So
Jersey's not doing so well right now.
Yeah.
All right, so let's talk about the news this time. Let me bring up our first topic, and I will just read it a little bit and then let you guys sort of comment, and that'll sort of get us going here. So this one is about the demand in plastic surgery. So I saw an article out of Facial Plastic Surgery and Aesthetic Medicine. It was also reported in edtimes.in, where plastic surgery demand spikes during COVID-19 for an unusual reason called Zoom boom. Many working professionals have no choice but to switch. Did we lose Sal? Oh no, he's still being recorded. He just
was it moving?
No, the video is disabled, but it says it's still being recorded, so we're still good. Many working professionals have no choice but to switch to the camera in virtual meetings. It's led to a rise in the demand for plastic surgery. People want to still look good. And although we are supposed to see others on these video chats, we get distracted by the thumbnail that shows us. And we tend to focus more on our physical and facial flaws in video calls. And this is called Zoom dysmorphia. Are you guys seeing an increase in plastic surgery demand because of this?
Absolutely. And so I think as we've talked about in previous episodes before, the overall rise in plastic surgery is tremendous. And Pacella actually pointed out to us on a distant episode in the past that we can actually improve the way we look if we put our face at a higher camera angle. And so I don't know about you guys, but the number of virtual consults that I've been doing have gone through the roof. And oftentimes during the consult, patients will actually start pointing to this area of their neck, and they'll actually start telling me, what about this? I don't want to take care of this. And it's not even usually the reason why they're on the consult, but during the midst of a Zoom consult, they want to start talking about neck contouring. And so on more than one occasion, I've brought up Pacella's advice, which is the need to put the camera at a higher angle, because I think I'm doing 5 to 10 times the amount of neck contouring procedures as I did prior to the pandemic.
Yeah, and just interestingly known on this podcast, I was neck shamed by these other two plastic surgeons here. Which is why I bought my own webcam that wasn't integrated. So I'm just going to start putting it like up here like this. Okay. So, no, but I agree. It's, there's a phenomenon that occurs, I think, in the average facial plastic surgery patient. That is, they notice things about themselves when they start looking in the mirror that they never noticed before or after, or before their surgery was. So internet aside or Zoom calls aside, do you ever have patients, the both of you, that say, well, why is one eyebrow higher than the other? and you look at the preoperative photos and it's clearly there, but they've had facial surgery and now they start focusing on this. So it's the same sort of selection bias that we see in patients. You know, they've always looked like that, but now their face is under a microscope. So I am seeing quite a big push and a big, huge impetus towards facial procedures. And on top of it all, everybody is saying, well, you know, this is a time for me to do it because I'm wearing a mask. You know, I've seen a huge uptick in rhinoplasties, in lip procedures, lip lifts, lip augmentation, just everything below here.
It's funny. I think from a recovery standpoint, that's why they're doing all those things in the mask area. But I also have a lot of eye and periorbital rejuvenation patients because that's what they focus on with the mask as well. So it's sort of funny when I never really thought of it, but they point out when we actually talk to other people in real life, we're not actually looking at our own faces. But when we're doing these video communications, we're always looking at ourselves in our little window. And as Sam said, these webcams are not very flattering. They did point out that these webcams have short focal lengths on their cameras. So the nose looks, they found 30% bigger on a portrait taken 12 inches away than, say, a camera that's 5 feet away, which is, you know, normally what most regular cameras are, as opposed to webcam. So when you look at that and you see this round face and these, like, you know, big noses, and as Sam said, like this thick neck, it just sort of emphasizes the things that we hate to see in ourselves.
Yeah, well, you know, the interesting thing is when you call it dysmorphia, that implies that it's pathologic. But I don't know about you guys. I'm doing more procedures in this area. So am I, in your mind, am I feeding into this demand? Should I not be doing procedures if it's dysmorphia? Because I'm doing a lot more neck contouring. I'm doing a lot more lip augmentation, lip lift, just like you guys are talking about. What are you guys doing?
Well, you know, I think it's a good point. When we talk about body dysmorphic disorder, we're talking about patients who get repeated procedures over and over again because they have a psychologic disorder. This is something that's pathologic and is a problem. I think you're right. It's really hard to call it dysmorphia if they see an issue and they just want to address that one issue, as opposed to a psychiatric disorder like BDD, where they're just continually getting procedures done.
I think this just feeds into the whole push in our society to label and compartmentalize everything in a certain discussion, you know. So I think this is just simply, you know, an opportunity for people to look in the mirror, mirror on the wall, you know. You know, it's interesting though when you see patients that they you know, they're looking on these Zoom calls and they feel like their appearance has changed. You know, there's a man out there right now who looks interestingly like Dwayne "The Rock" Johnson on a Zoom call. And that's Dr.
Who is that by any chance?
Hey, Dr. Jejurikar, do you smell what The Rock is cooking?
I wish I could just raise one eyebrow, but although I appreciate the compliment, the Rock is an incredibly handsome man, and so I don't want to put myself in that category. But you know, going back to what you guys are saying, I think that last sentence of the slide, an obsessive disorder called Zoom dysmorphia, implies a lot of judgment. And what I'm seeing in these patients are, if they come to me and they say they don't like the way their neck is, and I do liposuction or Kybella or anything else for it, and they get better, which they always seem to be getting better, they're generally happy. And so I don't think they're obsessing at all. I just think they're now having an opportunity to see things that they didn't see before.
It's looking
Absolutely.
in the mirror.
I agree with that, Sam.
Yeah.
Yep. All right, let's move on to the next. Dallas plastic surgeon defends cringy Borat 2 cameo. Dr. Charles Wallace, on his portrayal in Sacha Baron Cohen's latest, quote, "I was flat lied to and taken advantage with all the tools of Hollywood." And basically, in this Borat 2, if you saw the movie, he was given he did a plastic surgery consultation for what he was told were a pair of very wealthy Middle Easterners with an odd way of communicating. And they were in the area looking for information on rhinoplasty and breast implant surgeries. Portions of that meeting were filmed and recorded without him being aware, and they arrived and they made it into the Borat 2 movie. And there's an article out of centraltrack.com, and they basically said, at best, the scene is uniquely awkward, and at worst, it's wholly offensive. He's seen speaking stone-faced about the possibility of performing surgery on the girl, supposedly a 15-year-old daughter. And he is heard saying he would consider sleeping with the girl, quote, if her father wasn't there in the meeting. And along with his Sacha Baron Cohen's character, Wallace also engages in gross stereotypes about Jewish noses, even using his finger to exaggerate how long and bad they can be.
Have you guys seen this?
I have.
Yeah.
It is exceptionally cringeworthy.
Yes.
The one question I have, and Dr. Jejurikar in Dallas, perhaps you can answer this, is my understanding in the state of California, to be taped without your consent. I mean, now this wasn't a hidden camera, but let's just kind of go into this as a corollary here. So, what are the rules for audio taping and videotaping in Texas?
It's the same as it is in California, to my knowledge. But I read that article that Dr. Rhee was talking about, and it sounds as though they had him sign some sort of disclaimer that he did not read. Which I think to anyone in the audience, don't sign anything without reading it, because I think Chuck Wallace would probably be the first to admit that if he could go back, he probably would have read that disclaimer much more carefully, because it is cringeworthy. But if you read his explanation of why he was saying the things that he was basically told that this was an incredibly eccentric, wealthy Middle Eastern family. He was not told that the girl was 15, that they had an odd way of communicating, and to be very careful not to offend them. And so you can tell that what he's saying during this scene, there's not a lot of spontaneity in his answers. They're very measured, trying, I think, to fall within the parameters of what he was saying. He was, what he was supposed to say, and it just came across without the appropriate context as being very awkward. So my number one impression when I watched the scene with Chuck Wallace was, thank God they didn't come to my office. because any single one of us right here in the wrong context has made jokes which we regret and are inappropriate. And I'm not defending anything by any stretch of the imagination, but I'm also glad that I was not in that situation. And I know Dr. Pacella has to feel the same way.
Oh, 100%. I mean,
you're absolutely 100% right. I think it's a lesson learned for all of us that you never know what the hell is happening when you're, listen, when you're with patients and you're in a professional context. I would bet my house that both you, Dr. Jejurikar, and you, Dr. Pacella, are 1,000% professional, and you would never do anything that would not be professional, because I've known you guys for 20 years. But there are people out there who have been practicing for a long time. They let their guard down. They get duped and taken advantage of, and that's an unfortunate situation. It's funny, and actually, he says, if anything, this publicity for him, there's no bad publicity. He says it's great for business. He says he gets an occasional stoner calling in the middle of the night, leaving messages like, dude, can I get some potato titties? Which I didn't see the movie, so I missed the reference about that.
I don't recall that part either.
They asked if Borat asked if they could perform the breast augmentation on his 15-year-old daughter with potatoes. So, and appropriately, Dr. Wallace. And so the other things which are interesting too. So Chuck Wallace is a guy who's been in Dallas for a long time, has a very established practice, has patients that go back 20, 30 years. So I'm not sure how much of his business is coming from the internet, but what he actually said was, the publicity sort of rekindled some of his old patients to remember the great care they got in his office, and it's been good for business. The other thing, which I think is really interesting, was they showed a scene right after the scene with him where they were going through a quote in what appeared to be his office with a member of his staff. But he says in the interview, that's not anyone he's ever seen before, and it's nobody that works for him. So clearly there's some liberty being taken here, trying to frame this conversation in a way that probably wasn't intended. But and I think that's where the potatoes came up, is with that scene with the fake.
Mm-hmm. Wow.
I mean, listen, it's all in good fun, I think, hopefully. And if he's not, if his business isn't affected and if it's doing better, then God bless, and take it with a, good sense of humor, I guess. Yeah, but I'm really glad it wasn't me.
Enough said on that topic, eh?
All right. Let's move on. The next item. That's right. Yeah, if someone asks for potato titties, just say no. Just say no. Rough cuts inside the booming cosmetic surgery industry for designer dogs. Prized pups are getting facelifts, nose jobs, and fake testicles. And Greg Miller, the co-inventor of the prosthetic canine testicle known as the Nudicle, claims to have sold more than 500,000 pairs. That's 1 million single testicles, 500,000 pairs right there, in dogs. And basically, it's an article out of robreport.com. They said that to achieve physical perfection, owners rely on tricks of the trade, which is basically nip-tuck type surgeries for dogs, including skin fold reduction, which is adding or removing wrinkles, and nose jobs, and then, as we mentioned, fake canine testicles, mainly for dog owners who wish to conceal the fact that their male pets have been neutered. He wished to alleviate the discomfort of emasculated dog owners who would otherwise suffer comments by strangers who misidentify the gender of the pet. And according to the inventor, Greg Miller, Kim Kardashian's boxer named Rocky has a set of fake canine testicles.
Is that a HIPAA violation?
Wow.
That's right, man. That's not right. You shouldn't be outing a dog. That dog, man.
Yeah.
So embarrassing.
My dog does not have nudicles.
Crazy story.
Because that's interesting, because normally when we talk about getting aesthetic surgery, when we talk about getting aesthetic surgery, we normally tell people that at least I tell people, don't have surgery because somebody else wants you to have surgery. Do it because you want to have surgery. And there's no dog that I'm aware of that's clamoring to get fake testicles. Now, that being said, I don't know what the complication rate is, and if it's done at the same time as the as the dog is being fixed, maybe you could do it. I suppose. I'm not sure. Maybe it makes the dog feel better about himself. So maybe it's if there's an outcome study being done, the dog actually has higher self-esteem. I'm not really sure, but it seems fairly preposterous.
I'm curious to know what PETA thinks about this. I'm sure they have a movement to completely cancel this on the internet. You know what I mean? Let's just say, so there are certain breeds of dogs that are prone to issues related to skin and soft tissue. So obviously the Shar-Pei, right? They've got big, heavy hooded eyelids, and in order for them to see, it may be efficacious for them to get it trimmed. I will admit, I have done plastic surgery on my previous Labrador Retriever, but for reconstructive surgery. My dog used to get these massive seromas of her ear from shaking from ear infections, and these seromas would just come back and come back and come back. And, every time I went to the vet, it was about $1,200 for them to fix us. And so I finally said, nope. I took some lidocaine. We had a nice sterile area, and I, fixed my own dog's ears. So I'm not I picture myself on a ranch somewhere in Montana with no vet around. So, but this is just a ridiculous story. I mean, come on. If for the average house pet, why do they need this? Putting your pet at risk for infection.
It's clearly projection. I mean, listen, if you yourself feel inadequate in some way, you could imagine your dog is not feeling very happy either. And so then you're like, you know what? I want my dog to feel more masculine than me. I'm going to put a pair of big ones on him and he'll be happy, because if it was me, I would be happy with a pair of big ones too. That's my thought.
That's a good point. That's a very good point.
So it's not it's the owners. Obviously, the owners have issues here. That being said, that reminds me, there are a lot of breeds that have problems that do require surgery. I know all my French bulldog owning friends, they all get nose surgery because they can literally not breathe properly because of the breed standard. And I think this goes into the deeper aspect of breeds and these breed standards. And are we getting these dogs to the point where they literally, I think every bulldog needs a C-section because they literally cannot birth because the heads now are so big on these pups as they're being born. We are breeding these dogs to the point where they're no longer survivable without medical assistance, which is concerning.
I have a very strong opinion on this. I'm a firm believer in rescue dogs as opposed to breeders. I think breeders are out to make money. They, there's puppy mills out there. They basically inbreed disease into the dogs. And all three of the dogs I've had in my lifetime have been rescues and have been absolutely wonderful. So I highly encourage our listeners out there to rescue dogs. It takes a little bit of work, but
kudos to you.
This is very, very rough. No pun intended.
I think there was obviously a pun intended. All right.
All right. So the next item are the ASPS, American Society of Plastic Surgeons, our organization that we're all part of, released their statistics regarding 2019 procedures and what was done, and as well as predicting trends for the future. This was from prnewswires.com. And basically, they listed the top 5 most asked for treatments, which included number 1, Botox, number 2, breast augmentation, number 3, soft tissue fillers, number 4 was liposuction, and number 5 was tummy tuck. And then they listed the top 10 cosmetic surgical procedures, just straight surgery in 2019. And it ranged from breast augmentation, liposuction, eyelid surgery, nose reshaping, facelift, tummy tuck, breast lift, dermabrasion, neck lift, and number 10 was breast reduction. Does this correlate with what you guys see in your practice or what you did see this past year?
For me, largely yes. I'm curious what they mean by dermabrasion at number 8 there, if they're including laser procedures in there as well. If they mean skin resurfacing, yeah, that totally fits into entirely what I would see in my practice. I mean, I'm sure with all of us, there's some minor variations within the list, but these are all really common things. Though I don't do old school dermabrasion, a lot more laser resurfacing or chemical peels, which I'm sure you guys do as well.
Right. I think, breast augmentation, I think, is exceptionally popular, but it also is directly related to marketing, I believe. I think those surgeons that do a tremendous amount of advertising and marketing on the internet are seeing much more of this. My patient referral patterns are a little bit different, so I'm seeing a little bit more facial procedures, but I would say that eyelid, nose, and face, are right up there, exceptional. And then the soft tissue fillers from non-surgical treatments and Botox Dysport are exceptionally popular.
Right. I mean, I think it does depend on what you focus on. Like you said, if you're doing a lot of facial stuff, well, facial procedures were 3, 4, and 5, eyelid, nose, and facelift. If you do a lot of breast work, breast aug was 1, breast lift was 7. breast reduction was 10. If you do a lot of body work, it's, lipo was 2, tummy tuck was 6. So, regardless, I think any one of those top 10 procedures, depending on what you do a lot in your practice, those are our bread and butter. That's what we're doing constantly, for sure.
Do you guys do
and I think it's going to grow.
Do you guys do your own Botox and filler injections, or do you have people that do you have nurse injectors, and what are your thoughts on that?
Well, I know you are part of a large group of surgeons, and so you are all part of that Medispa, right? The one with that Nina heads up, and Epicenter, which is great. I do my own because I'm a single surgeon practice. I have no problems working or having other non-physicians do treatments. It's just what I do in my own practice. I think I've actually gotten trained by nurse practitioners and other skilled injectors. As long as they've had a lot of experience, I feel like these are things that anyone with a lot of experience and knowledge can do. I don't mind doing my own. I feel like it's still something I enjoy doing. How do you feel about it?
Same. I do some of my own. I definitely do some Botox myself, and I do some fillers myself. But the majority of it goes to nurse injectors that really have a passion for it, because I spend more time operating. So, but I have a lot of established patients who I'll keep doing it for. I'm kind of limiting the number of new patients that I do Botox and fillers on, just because of time issues and the fact, just like you said, there's a lot of other people that aren't necessarily core plastic surgeons that are really good at doing it as well. What about you, Sal? What do you think?
Yeah, I usually do it myself. I'm part of a big group as well, and we have an exceptionally good cosmetic dermatology group that I work with, that we are constantly sharing patients, sending patients back and forth. So it just works out well for our practice to have them do a majority of it. But I still do it on my personal patients,
Sounds good. All right. And last, CAP, which is a Committee of Advertising Practice, proposes ban on cosmetic surgery ads around kids' content. Now, this is out of the UK, and it's out of an article called thedrum.com. But I thought it was interesting to spur some discussion about advertising and who we should be marketing to, especially in this day and age with social media. The Committee of Advertising Practice suggests, and this is a body in the United Kingdom, proposed rules that would outlaw cosmetic surgery ads around all media geared toward under 18-year-olds, or shows that are or media that is likely to appeal to young audiences. So viewers of shows targeted towards young people would no longer be subject to breast enlargement offers during airtime. Procedures typically that were advertised included breast enlargements, nose jobs, and Botox treatments. But cosmetic products such as cream, makeup, and hair care products would be unaffected. And I think this was in part because there was an ad last year in the UK featuring a 21-year-old fashion blogger, Sarah Ashcroft, and that picture there is of her. And she was in an ad talking about her dislike of her body before having a boob job. And she said in her ad, "I never really looked at any part of my body past my neck because it wasn't something I like. I feel like a new person. Everyone was like, they're so natural. I was so impressed. I feel 10 times more confident. It's an amazing feeling." And this was an ad that was basically played on TV during shows that young people were watching.
Yeah, this is a very controversial subject, obviously. Children and teenagers, I'm sure you guys both will agree that it's much more difficult to be a teenager or a child in 2020 than it is probably even when we grew up, with social media and expectation. And this is just one more fuel to the fire, listening to ads while you're watching television. But, I don't think this really addresses the core problem, which is social media and imaging that kids see when they're, cruising the internet or on social media. It's there's an expectation that they have to be perfect. We were just talking about that with our first topic. So I think this is a good step, but it's a drop in the bucket. Sam, can you hear me? Oh, what is going on here?
Yeah, I would agree entirely with Sal. I think I don't even think it's that controversial of a topic. Yeah, we shouldn't be running cosmetic surgery ads to children. I don't think any of us would would be in favor of doing that. I just haven't seen. Are you hearing me? Okay.
Yeah.
Okay. I'm just, I have 3 kids. We all have kids. I've never seen cosmetic surgery ads during dedicated kids programs. I've not seen Botox, breast enlargement ads, whatever. I just see a bunch of toys that my kids want to buy, and literally I then get hit up for all these toys that they want to buy thereafter. But I think Sal is right. I think the biggest thing is social media. A lot of targeted ads will come up on, particularly my teenage kids' social media feeds, and this sort of ban on television content is simply just not going to address that.
I think that's the issue. I think Facebook or any of these other media companies can run ads wherever and whenever. There's no regulation in terms of how we target or how they target the audience. And I think that is the concern. And we have regulation for TV shows. We have no regulation for social media in regards to what they can and cannot target people for. And if people wanted to start targeting young people for these ads, on their TikTok or on their Snapchat or anything else, I don't think there's regulation stopping them. And I think that this is something that is that needs to be discussed, and we need to have a good conversation about it in our country. I'm not for more regulation for everything, but the fact that we have nothing and we haven't really talked about it much is, we as plastic surgeons should take the lead in terms of making recommendations before someone tells us what we can and cannot do.
And, the other important thing I think to point out here is this is not to say that children and teenagers will not benefit from plastic surgery. Okay. So for example, on the reconstructive side of plastic surgery, we see, young women who may have hit puberty early at age 16, at age 12, and have large breasts that are causing neck and back pain. They're socially ostracized. We may see kids with exceptionally large noses that are being ridiculed. We may see, young women with asymmetric breasts that they're in the locker room, and it may be a huge challenge. And those are patients that we can really touch and really, change their lives with positive things through plastic surgery. But that's not what this is talking about. This is purely a, make your breast bigger type of situation.
Right. And actually, that's a very good point, Sal. Dr. Rorik, I remember published an article a little while ago about underage or under 18 plastic surgery. And the categories of procedures that were considered reconstructive were gigantomastia, severe asymmetry, otoplasty, obviously
Right.
something like a cleft lip, like some cases of rhinoplasty. You're right. There are certain categories of conditions in juveniles that should be addressed with plastic surgery, but you're right. This is not that case.
Here. Yeah. Great points. I think I honestly haven't ever seen television ads. Have you guys for purely cosmetic surgery during kids program? I didn't realize this was even a problem.
I haven't.
in this country. So
I haven't seen that either.
No.
Yeah.
Botox, like morning news shows and stuff like that. That's really about it. Stuff like that.
Yeah. I think the advertisers are really smart because I know with my 4-year-old child, if I leave him alone in front of the television, which we are, in a bad parenting moment I might do, he has about 3 new toy ideas afterwards that he wants that he simply cannot live without. So Botox would just go right past them. Yeah.
All right. Well, excellent. Thank you, gentlemen, for another awesome episode. I really appreciate it. I always learn something from you guys.
It was great as always, gentlemen. Always, you never know where this is going to go, but I learned a ton as always.
All right.
All right, gents.
Thanks again.